Okay, so another legal issue that I want to hit on is the idea of negligence. So you've obviously heard of this a couple times now. We talk about it in first aid, you talk about it in intro. Um, Negligence is the idea that you are providing care that falls below a minimally acceptable standard. And so that standard is usually set by that scope of practice that we talked about previously. So either your scope of practice, professional standards of practice, again, maybe your facility policy and procedure manual, your job description, best practices, even if it's from another healthcare provider, especially if there's not precedent within your field, they might pull from a related healthcare provider. Your state practice acts, anything like that could help set what that minimally acceptable standard is. Um, Licensed professionals, okay, tend to be seen as more of what we call independent practitioners or independent contractors, meaning that if they are sued for negligence, they stand much more on their own than also relying on their employer. So it becomes much more personal to the provider. The employer might also get named, but a lot more stands on the professional because of the standard of care and the standard of practice that we're held to. Okay. Exception to that being that a supervisor can be liable for their employees, okay, and will probably also be named, but that doesn't excuse the liable nature of the employee. So supervisors or employers can be liable for the employee as well as for the student. So whatever you do as a student directly reflects onto your direct supervisor, to the athletic training department, and also to the athletic training education program. So all of us could be held liable for your actions. So again, making sure that you are following regulations is really important. It's what we call vicarious liability, where someone can be responsible for something someone else did. Now, for negligence to be proven, the burden is all on the wronged party, okay, on the reporter, okay, or the patient or whoever it might be. And what they have to prove is they have to prove that this individual, the practitioner, had a duty of what we call due care. So again, they had this scope of practice, they had this duty to uphold these minimally acceptable standards. There has to be a breach of that duty. So it might fall short, or it might have gone beyond the scope of practice or outside the scope of practice, or it wasn't within the typical best practices for this individual. Then they have to prove that there was harm that occurred. So the individual had to suffer either physical or financial harm. Mental distress is also one that's often put in as a form of harm. And then there has to be causation or cause. So the negligent act, so the fact that the person had a duty, breached their duty, that breach, that negligence had to have caused the harm. So the example I always go with is, right now, state of Minnesota, not allowed to put in stitches as an athletic trainer. So I have an athlete who popped open, a cut above their eye, and I think I'm actually a pretty good sewer. We don't have a physician around. We need to get this person stitched up. I'm just gonna do this, right? I have some needles around from when Fetzer's here. They're in the closet. I'm gonna try this, and I stitched them up. Okay, obviously I had a duty. I breached my duty because it went outside that scope of practice. The key here is there harm? Maybe I am just really good at doing stitches and it's a perfect thing. There's no scar, everything's wonderful, no infection. They can't prove that harm actually happened. Okay, there's no cause. Okay. Now that's not to say that they can't bring in other issues, especially with my with the State Practice Act. They could get me in violation of that, so I could get my license revoked or my registration revoked. They could get me with the BOC that I'm not following state action, so they might revoke my certification. But legally, as far as negligence goes, there's potentially no case. Now, if I do this and they get some nasty infection and they can prove that it's because of my my negligence, then that is a case. Negligence can occur from the delivery of a treatment, which is what I just described, okay, where it's about my care, or what we call care facilities. So, um, if the person um, does not create the safest environment possible, like they don't follow state codes, they don't get things inspected, or their equipment calibrated, if they don't maintain that equipment and then someone gets injured, that's also a form of negligence. So the care of the facility and the delivery of the treatment. So back kind of to the delivery of the treatment, okay, that is usually the legal wrong that occurs is usually what we call a tort. And there's several different types of torts. The two major categories are what we call an act of commission and an act of omission. So omission is the failure to respond in a situation in order to limit the harm. Okay, so I don't do what I was supposed to do. Commission is acting on a situation, but I don't perform to the level of my expected scope of practice. So I do improper technique, or again, I do something outside of my scope. And so on Moodle, you actually have a little exercise too of some different types of torts and descriptions, what we call malfeasance and misfeasance and nonfeasance. So you'll do that exercise after this video. So over on this is from your book, and again, just thinking about the care of facilities, some things to keep in mind, specifically around modalities and doing treatments that would create a situation that you could be negligent for.